The Miami International Film Festival got going this week. Theatrical releases, as they usually do, get most of the attention there, but there are also worthwhile smaller films, and one of the featured documentaries is called Once There Was a Country, revisiting Haiti. It focuses on the healthcare crisis in Haiti, and joining us today is the writer and director, Kimberly Green, who happens to be from Miami Beach. Kimberly, good morning.
Good morning.
Great to have you come in. Tell us about this film.
Well, the film Once There Was a Country, revisiting Haiti, it took 2 years to film the piece, and we're covering a healthcare initiative that's been going on in Haiti for about 10 years. And it's a healthcare initiative that encompasses all aspects of public health and addresses both political, environmental, and all different areas of the community.
Well, let's roll a little bit of the video that you brought from the film, or I should say, let's roll part of the film, and tell us what we are looking at.
Scraps of wood, home phones.
Here you're seeing a home of a family that lived in the Central Plateau in a town called Tomon. This gentleman, Sonson, and his wife, they have 6 children, and they all have tuberculosis. And Project Metashare, which is the healthcare program that we're covering in this part of the piece, they have a program that they call Direct Observed Therapy. And they have healthcare workers that they train that go every single day to visit families like Sonson. And they make sure they directly observe them taking their medication.
Right. And who funds Project Metashare?
Project Metashare gets mostly private donations. They're now getting funds from different government programs within Haiti and international aid groups.
Yeah. You know, Kimberly, I spent a good deal of time in the 1980s into the early 90s in Haiti covering all kinds of political developments. And I have to say that I have never seen poverty as endemic, as pandemic as it is there, and I certainly saw a lot of people who looked ill, who were receiving no treatment at all, because the government simply didn't have the kind of health system to treat them as, you know, certainly not the way we do. Is the government able to provide any of these kinds of services meaningfully?
Well, the Ministry of Health has been working directly with Project Metashare now and other organizations within Haiti. But I think the infrastructure has been so volatile in Haiti that it's been difficult to actually get healthcare out into the communities in the countryside.
Right.
And people tend to focus mostly on the cities. And what I like so much about the programs that we profile is they focus on the countryside, because if you keep people healthy in the countryside and help them become productive, they won't be moving into the cities to overcrowd the cities.
Right. Do you mention this American doctor from Boston? Forgive me, I forget his name. Dr.
Paul Farmer.
Paul Farmer, right.
Correct.
The book was just written about him last year. Really interesting book. Do you mention Dr. Farmer and his work?
Actually, Dr. Farmer is a partner of Project Metashare. And I should say Project Metashare was founded by 3 University of Miami doctors. And they take down 3 times a year, or now more, University of Miami medical students. And they get to work directly with Paul Farmer, and his hospital is in our area. So we work in conjunction with him and the Ministry of Health.
Right. Of course, what somebody who hasn't been to Haiti just can't conceive is that even getting out to the country is hard, because when you think about roads, well, I mean, I remember one time I drove to Gonaive from Port-au-Prince. It's only, what, 50 or 60 miles, and it took 5 hours.
Correct.
I think. It is so hard to just even get out in the country.
It took us about 6 hours, 5-6 hours to get up to our community in the Central Plateau. It's a problem. The infrastructure, the roads, it's a big problem. And that's one of the reasons why there's not a dissemination of information. So elections have sometimes not gone exactly how they would like.
Right. Very briefly, in the early 80s, Haiti was designated by this country as a place for Americans to be careful. It was at risk for HIV and AIDS. That had a devastating effect on the tourist economy, because then at that time tourists were still going to Haiti. The treatment of AIDS and HIV, that is covered in your film as well.
Yes, that's actually a major part of the film. And what's so important, and I'm really, really glad that you brought that up, is that the Direct Observed Therapy program is almost 100% effective in keeping people on their medications. They actually have a higher compliance rate than we have here in the United States.
Well, how interesting. All right, so the movie is going to be shown on February 10th, Thursday night, at the Cosford Cinema, at the University of Miami, 6 p.m. I'm going to do my best to come out. That will be the premiere, and you are going to have Maya Angelou do the narration?
Yes, she's narrated the film along with her son, who's also a published author and a poet, and just incredible voices, and there's such beacons, I think, in this fight for social justice. Right. So having them narrate the film, I think,
very
really
exciting.
gives
Kimberly Green, good luck with your project.
Thank
Look
you.
forward to seeing it.
Thank you very much.
All right.